Hello everyone, welcome to the Basics of Suturing series. Suturing is one of the most fundamental skill every medical student and intern should learn. However, before we start placing the stitches, it is important to understand the material we work with. In today's video, we will learn what is suture, difference between suture and a needle, types of suture material, how to read a suture pack, and importance of needle curvature. So let's get started. So what is a suture? Suture is a sterile single strand of material used to approximate the tissues to facilitate wound healing after surgery or injury. This one here is a sterile suture pack. What is the difference between suture and a needle? There is a common misconception that the entire unit is known as needle. But let me show you. In reality, a surgical suture consists of two components, the needle part and the thread part. It is called needle and this one is known as suture. What is the difference between them? Suture is a thread-like material, holds the tissues together and can be of various types. For example, absorbable or non-absorbable. And the needle is a metallic instrument, passes through the tissues and can vary in size and curvature. So basically, needle that creates the pathway, while the suture material maintains the tissue approximation. So what are the types of suture material? It could be absorbable or non-absorbable. Here I have both the types. This one is non-absorbable and this one is absorbable suture. The absorbable suture, which are gradually broken down and absorbed in the body. For example, Vicryl, Monocryl, PDS or catgut. This one is PDS. These are used in a subcutaneous tissue, mucosal closure or internal tissue approximation. Non-absorbable suture. The non-absorbable suture remains inside the body until it removed or permanently retained into the body. The example are silk, nylon or proline. It is used in skin closure, vascular repair and tendon repair. It can also be of monofilament and multifilament. These both are of monofilament. What is the advantages of monofilament? Since it is a single-stranded, therefore less tissue drag and lower risk of infection. Whereas multifilament is having multiple braided strand, better knot security and easier handling. And let's understand about the suture pack. Every suture pack contains a lot information. Every suture pack have information such as what is the suture material, suture size, what is the type of needle, lot number and an expiry date. So let's see about the suture size. Here the 30, this number indicates the suture size. The more the zeros in this number, which means the finer the thread is. For example, a 40 or a 50 thread will be more finer than a 301. Here this one is a 20, which means the suture is more thicker than this one. So just only learn that the more the number of zeros are present, more the finer suture is. For example, 20 is thicker than 40, 40 and is thicker than 60. More the number of 0, for example, we can go up to 60, 70, 80, which are used in microsurgeries. Then what is the importance of needle curvature? Here as you can see, the needle curvature is written 3/8 of the circle. Okay. The curvature determines how easily the needle can be manipulated within the surgical field. For example, 1/4 circle needle used in superficial wound, easily accessible areas. This one is 3/8, which is used in more commonly used in skin closure and general surgery. Here we have 1/2 of the circle of the needle, which is used in deeper tissues, soft tissues and abdominal closure. We also have 5/8 of circle needle, which is used in deep confined spaces and pelvic surgeries. Also the length of the suture material is given here. For example, here is 70 centimeters. Here it is given. it is also 70 centimeters. Also the type of the needle is also given. For example, here it is a reverse cutting type. You can see the cross section of this. The reverse cutting is basically used in a skin suturing because skin is a tough structure. So it is for easily handling the needle for easy suturing. Here you can see this is a round body, the cross section round. Here no cutting edge is given. Therefore it is used in visceral suturing, suturing the viscera or the internal parts. You can also tell the difference which one is absorbable and non-absorbable without reading the label. The non-absorbable one comes with the transparent packaging because it is not affected by light, whereas the absorbable one comes with non-transparent packaging as it can be degraded by light. So now we understand suture packs. We are ready to learn the instrument required for suturing. In part 2 of this series, we will discuss about needle holder, forceps, scissor, artery forceps and how to handle all these instruments. Thank you for watching. I'll see you in your next video.